Okay, so first off, we're going to go over the signs and symptoms of hypo and hyperglycemia. So a good little saying to remember both of them is cool and clammy, need some candy, and then hot and dry, sugar high. And also with hyperglycemia, you'll often see the 3Ps, which is polyuria, polydipsia, and polyphagia. With hypoglycemia, they'll often be irritable. Depending on how low it is, they can become confused, lethargic, and often if it's very low, you'll see seizures, coma, or combativeness. After that, if you check blood glucose, you need to treat it according to what it is. So if you have hypoglycemia, of course you need to give some kind of insulin, glucose, or something to get their blood sugar high, some kind of dextrose IV or glucagon or glucose if you need to get their blood sugar up. If they're hyperglycemia, then of course you would need to administer insulin according to a sliding scale, document that, and follow the six rights of medication administration. So now I'm going to go over how to administer medication according to a sliding scale. So we checked my patient's blood glucose, and it was 215, so we're going to give 5 units of NPH, and we're going to give 5 units of regular insulin. So first off, you want to check your patient. You would check your blood glucose, and then you compare it to your doctor's orders and your MAR. Next, you need to get another nurse to witness your insulin, but first you'll have to draw it up. So first, you'll clean the tops of both, and then you will take the cap off, and you will, of course, clean your hands and don clean gloves at this time before this. And then you will draw up 5 units of air for the regular insulin, and you'll always want to do first you do the NPH insulin, and you do 5 units of air into it, making sure you don't touch the needle with the NPH. Then you do 5 units of air into the regular, because when you draw it up, you have to do clear before cloudy, and you can't mix the two. You draw up 5 units, inject the air, you draw up 5 units, boom, you get your 5 units there, and then you inject it into the NPH. Get your cloudy second, get your 5 units here, then you're done there, and you will not recap this because you don't want to stab yourself. And then you go get another RN and you ask them how much insulin you have in this syringe, and they will tell you how much they see. If they see 10 units, then you're correct. You tell them you have 10 units. Now you're ready to go give the medication. Then you go back to your patient's bedside, you check on them one more time. They still look like they have hyperglycemia, which of course they will. You go back and then you clean their site. You ask them which site they have. Yesterday they got insulin in their left arm, so this will be their right arm. So you clean it with their alcohol swab. You undo your cap. You pitch the skin so you get it in the subcutaneous tissue. Then you inject it like a dart. Inject your 10 units. Let go. Draw your insulin out. Make sure they're not bleeding. Make sure you have given all the insulin. Don't recap your needle. Put it in the sharps container.